morning. I am Dr. Abrina. I am a visiting radiation oncologist here in Davao Doctors Hospital. You can find my clinic in the Cancer Center building, ground floor radiation oncology department. So for this morning, I will be discussing what is radiation therapy. Now, yung radiation therapy po, it is a form of cancer treatment that uses high doses of X-rays or radiation to kill cancer cells and shrink tumors. Now, itong radiation na to, the target is the DNA of the cancer cells. These high doses of radiation kills these cells or slows their growth because the radiation prevents the repair of these DNA damage. There are two main types of radiation therapy. It can be given externally or EBRT or internally, which is brachytherapy. My topic for this morning will focus more on the external beam radiation or yung mas familiar type of treatment, which is X-ray treatment. External beam radiation refers to the delivery of radiation from a machine. Kumbaga, parang X-ray po or CT scan. It is a local form of treatment, meaning only specific parts of the body are killed. There are many types of external beam radiation, and actually there are several machines that are available for your treatment. But the overarching goal, or yung pinaka-goal po natin, is to deliver the highest prescribed dose of treatment to the tumor, while of course, trying to spare or exempt po natin yung mga local normal tissues which are around your tumor. So let's start first with the basics. In the olden days, yung ginagamit po nating treatment would be the Cobalt Treatment. Ang ginagamit po nating planning dito ay X-rays. Of course, you're familiar with an X-ray. Ito yung simple machines na tinitingnan po natin usually yung lungs or other parts of the body that we want to examine. So, in these conventional treatments, yung ginagamit po natin ay limited number of beams lang. These are simple shaped, like for example, they can be squares or rectangles. And we target them like X-rays, and because of that, there's only a limited conformality or limited shapes that are achievable to target your tissues. For example, when you treat the chest, for example, in breast cancer, you're only able to give big fields or like target directly the lymph nodes, for example, here in your supraclavicular area or dito sa collarbone or dito sa axillary bone or kilikili. Another form of giving radiation therapy is through 3D conformal radiation therapy. Here we use three-dimensional images, for example, pwede tayong gumamit ng CT scan, MRI, or even in sophisticated cases, we can also use your PET scan. The purpose of these 3D scans is to determine precisely where the treatment target is. For example, we use it for the central nervous system or your brain para makita natin kung saan yung precise target. Or for example, head and neck cancers, most commonly tinitreat po natin yung nasopharyngeal area or yung area po na nasa likod ng ilong natin. So in 3D conformal radiation therapy, we make use of a computer program to analyze the images and design radiation treatment fields that conform to the shape of tumor. In simple terms, we use a computer system to accurately target the area to be treated. For example, yung certain lesion lang po or yung certain bukol lang po natin sa brain or yung bukol po sa likod ng ating ilong. Because the treatment is three-dimensional, we can use many treatment fields. For example, seven different directions as opposed po dun sa mga conventional natin na ginagawa na usually dalawa lang po or like front and back or to the sides. The precise shaping that 3D conformal radiation gives us will allow for precise targeting, and of course, we can maximize the dose of the tissues while sparing normal tissues. So in terms of the conformality or to the degree by which other normal organs are spared, mas mataas po tayo dito sa 3D conformal radiation therapy because we are using seven radiation fields or a more number of fields in comparison to our conventional radiation therapy. Another sophisticated form of giving radiation, ibig sabihin mas modern po ito, ay yung intensity modulated radiotherapy or tinatawag po natin IMRT. Now, like 3D conformal radiation therapy, we can give radiation through many beams. For example, kanina, pwede tayong gumamit ng several beams to target a single area in comparison po dun sa ating conventional radiation therapy. Now, ang pinagkaiba po ng IMRT sa 3D conformal is that we can divide a single beam into several beamlets. For example, a single beam that targets the chest wall can be further broken down into stronger beams or lower energy beams. The purpose po nito is that we can give the highest dose to the target tissue while minimizing the dose to the normal tissue. This is very useful for areas that are crowded together. For example, yung central nervous system po natin, brain, kasi marami siyang katabi, we want to minimize the dose to the other normal organs. Or for example, yung ating head and neck area, kasi di ba magkakatabi po yung ating esophagus, yung ating larynx, para ma-minimize po natin yung side effects. We want to vary the dose with the single beams. Now, meron pa rin po tayong further evolution with our radiation therapy treatment. And this next one is the one that we here in Davao Doc are excited to present to you, because this is about image-guided radiation therapy. Image-guided radiation therapy, or IGRT, is a type of IMRT. In this case, imaging scans are not only used for treatment planning, but before radiation therapy sessions themselves. So they are also utilized before radiation therapy sessions in the treatment room. For example, nandun na po kayo sa loob ng treatment room natin. Kunwari nasa tomotherapy tayo, before tayo mag-daily treatment, ay isa-scan po natin yung area to be treated. Kasi we want to make sure that we are matching the plan before that we made prior to your daily sessions. Nagtutugma po yun dun sa inyong daily treatment. These scans represent your daily patient setup, and these are processed by computers to detect changes in the tumor size and location. So, the repeated imaging allows the team to reposition you. For example, in breast treatment, nakaganito po kayo. If there are any changes in your positioning, we can intervene para maayos po yung inyong positioning dun sa mismong radiation session. As you can imagine, these verification and adjustments can improve the accuracy of your treatment and help spare normal tissue. Kung naaalala po niyo po yung dati, we also discussed the conventional radiation therapy process. Now, these processes actually make use of the X-rays. And sa X-ray po, yung madalas po natin nakikita ay yung mga bones po natin. Kunwari, yung mga tinatawag po natin bone landmarks. So, yun po yung basis ng ating radiation therapy treatment before. So, that was in the conventional era. In conventional radiotherapy, where X-rays are used, the target is not always visible, and the identifiable surrounding anatomy is often a poor surrogate for the target. Hindi nagtutugma po yung ating bony anatomy dun sa internal soft tissue organs natin. Kasi hindi naman po madalas po nadi-displace naman po yung ating kunwari heart, yung ating bituka, or yung ating other organs dito sa ating tiyan, kasi gumagana po sila sa loob while fixed po yung ating bones. Because of that, we actually used to use very large treatment margins for the treatment of cancers. Now that we have tomotherapy, we can shorten or minimize these margins para ma-focus po natin yung radiation kung saan niya mismo kailangan, which is the tumor, and spare the normal tissue organs. Now, in the next coming months, we are excited to offer you tomotherapy. Tomotherapy is a type of IMRT that uses a machine that is actually a combination of CT scanner and yung external beam treatment delivery system natin. So, it's actually a donut-shaped machine where a patient goes inside. Doon po ginagawa yung CT scan for verification of your positioning, at doon po mismo binibigay yung radiation therapy session natin. It is a machine that is capable of image-guided radiation therapy, which we discussed earlier. It takes images of the tumor right before treatment sessions and to allow for very precise tumor targeting and sparing of normal tissues. So, the thing with tomotherapy is that it can give 360 degrees of rotation around your body. Conventional machines allow radiation to be delivered from only a few directions. The tomotherapy treatment is mounted like a CT scan, which means treatments can be delivered continuously from all angles around the patient. More beam directions give us, your physicians, more control in how we plan your treatment, and more assurance that the dose that will be confined is only greatest to your tumor and least to your normal tissues. So for our patients, of course, when it comes to cancer, it's always about early detection and keeping a healthy lifestyle for prevention. Now, if you get cancer, it's of course always a challenging thing to experience. But we here are prepared to give you the best treatment, and with image-guided radiation therapy, you can be assured of comfort and that we can minimize the side effects to your body. And if ever there are side effects, meron po tayong pwedeng gawin para ma-minimize yung distress na mararamdaman mo during treatment. Thank you for giving me your time, and I hope you learned a lot. And if ever you want to learn more, you can visit any of us here in Doctor's Hospital.